Hi, I'm Sharrie Harlin-Davis, and welcome to this episode of Reid Beside You. Today, our topic is suicide prevention, and our guests today are Tanja McFarland and April Coffin. Welcome. And before we get started, tell us how you came to Reid. You want to start, Tanja?
I sure will. I started at Reid 13 years ago. I started off as a discharge planner and then just went up to the inpatient psychiatric unit, became an outpatient therapist, and now I'm over the lead EAP counselor, and we do therapy for our employees and their dependents. And so we're all licensed therapists on staff.
Just to clarify, when you said EAP, to our audience, what does EAP stand for?
It stands for the Employee Assistance Program.
Okay.
And so, again, we do therapy for employees and their dependents.
Great.
Thank you.
And April, and how
Hi.
did you come to Reid?
So I have been with Reid for 2 years, and I moved here from California previously, where I gained most of my experience in behavioral health. I worked for a foster care agency and opened up a behavioral health clinic. And then I was fortunate enough to join the Reid psychiatric team about 2 years ago.
Oh, great. And both of you with their backgrounds, actually, your official title on your name badge says clinical social worker.
Yes.
But
So,
what else do you do?
so I'm a licensed clinical social
Okay.
worker, so a therapist, as Tanja is, and I can provide psychotherapy or therapeutic services, but I'm also the clinical manager of Reid Outpatient Psychiatry.
Okay.
And we have practices throughout the community, not only in Richmond, but in Connorsville, Liberty, Cambridge City, and we even do telehealth services out in Ohio, in Eaton and Greenville and Winchester.
Okay, and so both of you stay very busy.
Yes.
Since we're talking about Suicide Prevention Month, and September is Suicide Prevention Month, what are we looking at, some of the trends nationally? What have you seen?
According to statistics that I pulled from the crisis text line, which is a new thing that April is going to be talking to you about a little bit later, suicide is still the 10th leading cause of death in the United States, and Indiana kind of correlates along with the national statistics. It's the second leading cause of death of individuals between the ages of 10 and 25.
Wow.
And males are 4 times more likely to commit and succeed in suicide, but females attempt 4 times more.
Okay. And you look at risk factors. So when we look into the risk factors, are there some are more prevalent, or do they go along with more of the age group or the demographic?
Absolutely. So we kind of separate risk factors in 3 different categories. So
Okay.
we can start with the health first. So people that have more depression, substance misuse, bipolar disorder, schizophrenia, those mental health disorders. Chronic pain is also another very high risk factor. Those people that just cannot get rid of their pain. And then traumatic brain injury. Those health conditions can increase someone's chances of being suicidal or pose that risk. There's also environmental risk factors,
Okay.
and those can include access to lethal means. So somebody that has those health risk factors, that have access to medications and weapons, their chances can increase. Prolonged stress, that's very hard on people. When they don't have any other resources, and they just struggle with finding help for their prolonged stress. Stressful life events, major life changes, the death of a loved one, divorce, financial distress, and then just exposure to suicide. So when there is a parent that commits suicide, the chances actually increase for their children.
For their children.
Absolutely.
That's interesting to see that factor.
We also look in peers.
Okay.
When we are talking about young adults or adolescent age kids, if someone in their peer group or in their school has attempted, we tend to want to pay more attention because that's a risk factor.
So is that another reason often if there's a traumatic event in the school systems that they often bring in professionals to speak with the students?
Yes.
Is
Yeah.
that another reason?
To help cope with the traumatic event, and then also to assess to make sure to see how the children are doing.
And I know that we've had a crisis in our community, and you were there to speak with students and actually calm people's fears.
Yes.
And
Yeah.
so interesting.
And not only immediately after the traumatic event, but also reassessing later on, because a lot of people respond differently to trauma.
And that's a good point.
Yeah.
That the prolonged after effects, that people don't realize that.
Yeah. There's some historical risk factors that can increase the chances as well. So previous suicide attempts, family history of suicide, and childhood abuse, neglect, and trauma also increases someone's chances. Those are some risk factors to look out for.
And also, and just in where we had looked at the environmental, and just in like where they reside. Have you seen more if someone's more in a group setting, or along with the school setting, similar behaviors?
Yes,
Okay.
I think as far as different academics or cultures even, Native Americans and Alaskan, they have the highest rate, whereas African Americans have the lowest suicide rate.
I think it also varies. So resiliency is an amazing factor. So people can experience the same trauma, and just some people are more resilient than others. I think it's challenging. So we would think that certain socioeconomic groups possibly could have a higher suicide rate, but suicide does not discriminate. It happens it can happen in any community, any race, any ethnic background, any socioeconomic status.
I have, in researching, saw an interesting fact about autocide. And when it's a one-person accident, and it was mainly men, older men, and that way you couldn't determine that they were actually committing suicide, but people couldn't really track that because it's one person, they ran off the road or ran into a tree. And one of the big factors was they wanted to make sure their family received life insurance. So I thought that was a really interesting factor, and just another feature in suicide that people come up with a lot of different avenues, which also made me think, do you realize when people are coming to get help, that that's one of maybe a factor that they're trying to reach out and get help, because if they've done that much studying about it, they had thought about that suicide attempt very early on.
Yes, a lot of times you'll see that they'll talk about suicide or feeling hopeless, helpless, not having any worth or value, feeling trapped in the situation, just also often feeling like there's no other way out.
Right. So we can go back to some of the, like we're saying, that would be some of the warning signs, correct? That you were saying that they're killing themselves and the hopelessness.
Yes. Unbearable pain, whether it be emotional or physical, is a big factor in that. So individuals that deal with chronic pain often feel, again, hopeless, or that there's no other way.
And then when you brought up that chronic pain factor, often people say they committed suicide, and it might have been a heartbreak, a loss of a loved one, but they don't. A lot of times people don't factor in that chronic pain can just become their quality of life has just ceased, so that they think that's their only way out.
Yes.
I think those are some of those warning signs, right? Those individuals that, as Tanja referenced earlier, that are talking about suicide, they may seem a little passive, but until you fully evaluate, they may be more committed than someone might realize. So just those individuals that are talking about their guilt, their shame,
withdrawing from activities, if you find that they're using more substances, alcohol and drugs to cope, that's a significant sign. If they start giving away some of their prized possessions, or talking about goodbyes and finalities, is often a sign that we want to look out for as well.
So that's we're back on looking at warning signs.
Yes.
So back on the drugs and the alcohol, looking at more of the impulsive behaviors. So what are some of the other things that they would do under a impulsive behavior?
Those often we want to look at, are they partaking in risky behaviors, driving erratically or too fast and not caring, doing things knowing that that's probably not the right thing to do, or legally that's not the right thing, but they just aren't caring at the time, becoming fatigued, becoming aggressive, irritable, agitated. If you see a loved one, they'll isolate from families and friends.
That's a big gulf there. So either they're very tired, or then sometimes they're just very aggressive and very active. So
Yes.
and
Yes.
so family members and friends should definitely look into those activities.
A change in behavior. I think when you know somebody, you can tell that their disposition has changed or their personality. So somebody that might be normally outgoing, and then they are reserved or become isolated and depressed, crying more often.
Someone that's pretty laid back, if they start becoming more agitated and irritable, snappy.
Or maybe someone that uses recreational drug use, and then they start mixing medications and drugs and alcohol, those risky behaviors. Those are just some pretty big warning signs.
Definitely signs that you should be aware of.
Absolutely.
And also then just about emotionally, some of the overwhelming emotions. What were some of those?
Oftentimes, depression is a big one, sinking down into a low depression where you can see that facial expressions are not showing any affect, much of a change, anxiety, anxiousness.
And I want help me understand, because lately in the news we see so much about anxiety. Is that a real thing?
It absolutely is a real thing. If anyone's ever dealt with
And I didn't mean that rudely.
absolutely not.
I ask this all the time, and more you hear people say, "Oh, my anxiety is really over the top."
And we hear it in younger generations.
Yes.
So we hear it in little kids. Oh, I'm anxious. I have anxiety. So you're right. It's. I think we're just. There's more education on it, and more people are becoming aware. Oh, there is a name behind that symptom.
Right, and especially as April was talking about kids, they're often will come in the form of stomach aches. They'll have often stomach aches, have to go to the bathroom a lot, feel like they're going to throw up. That's where their anxiety tends to come through and show. Also, kids, their communication typically is through their behavior.
Yes.
And so if you noticed a child acting different than what they normally do, then that's a red flag to us, and we want to assess and see how things are going.
I was just reading when they said, and the article was stating, often with children, they will say, "My tummy hurts."
Yes.
And so that's a clear sign that you should investigate it more.
Right.
Because that's their only method of saying something's wrong.
They have a hard time, one, even understanding what am I feeling. My thinking and my feeling, are they matching? And so they have a hard time communicating that. And unfortunately, and we'll talk a little bit later about the stigma, but unfortunately sometimes they get, "Oh, you're not, you have nothing to be depressed about.
Right.
You have nothing to be anxious about." But unfortunately these children, that's what they're feeling. And even though we might look and say, or not feel that that's a valid reason, but it is. And so we do need to listen and see how people are feeling, because they know their own self.
Some of the other things like humiliation.
Yeah, I think that's a big one. So, and we can even see that on social media, those big events that happen where somebody's felt humiliated. We see that all the time on the news, and we see it in therapy.
Speaking, we didn't bring this up, but social media, how does that have an impact on anxiety, humiliation? How does that play into?
I think with social media, it's such a hard piece because it can have such positive, but then also on the other end, you know, when we talk about the adolescent population, they can't escape it. I remember, I'm not going to say my age, but I remember when I was in school, there was not social media. We didn't have cell phones. And so there wasn't that direct instant access to
if you fell down the steps, you fell down the steps to the people that saw you fall down the steps. Now someone can
now the whole world
the video you and send it to everyone they know, and people that you have no idea. It's like, "Oh, you fell down the steps today."
I know.
So it just never goes away.
And people do it to purposely embarrass others. So it's like Tanja said, it can be a great thing, it can provide education, but at the same time, it can really hurt adults, adolescents, the geriatric population. So
I know when I was growing
for our
up,
seniors.
absolutely. You know, I was growing up, if anything happened at school, you went home, you didn't have to deal with it maybe till the next day. Now it's 24/7 for these kids and adults because they get this, you know, the same thing. And so I think with social media, they're just in the limelight all the time.
As well as, and some people are doing things for likes, and
Yes.
and if you don't, and it can just mess your whole day up
Absolutely.
for that population. So,
Absolutely.
And learning how to take your emotions.
Absolutely.
So that can be a big thing, as well as then on the other side, the whole agitation of could be from social media, and then
Yes.
people are enraged and take their actions out on others.
Political statements are a big one that really gets a lot of individuals in an uproar. And have a hard time then not looking at the social media, and the more they look at it, the more they boil, and then it's just whoa.
So what an example? How would you talk to someone, or
In the sense
in a
of,
sense of if you could see they were getting enraged, how would you back on referrals, or how would you try to bring them to a more normal state?
I try to process. At least what I try to do is I try to process them. One of what are their thoughts, what are they thinking, and trying to get them to recognize how that's making them physiologically respond, and is
Okay.
it healthy for them? Because as a therapist, it's not my place to say if something is good or not good for someone, but it's up to them to decide what's good or not good, what's healthy and not healthy for them.
So more reflecting back, so that they can
Yes.
reflect back to you.
Yes.
And I think if you're a family member or a loved one or a friend and you see that your family member is enraged or humiliated, it's always important to validate their feelings, because you don't know how they're actually feeling. So validate them. You could help them seek professional help, but also even just distracting them or getting them to do something else to help them relax and calm down their agitated emotions.
On that note, have you had like more families come for group talk or services by any chance?
Families to try to understand. If I have individuals come in where families might not understand if they're dealing with depression or anxiety, if they've never had to deal with it, or if they just don't understand it, I try to bring them in to help explain where it is, because, you know, we both can go through the same experience but take something different away from it.
Right.
And I think that's important to understand. And again, we go back to this, we'll talk to the stigma later, but the stigma plays a big part in that as well. Because what happens, you know, if I'm a parent, what does that say about me if I have a depressed child? Or
We're a happy family.
or yes, or if
So
I'm
you can't be depressed.
right.
Right.
And so, as April said earlier, it's very important just to validate the feelings. Even if you don't understand it, just listen to them and validate the feelings. Because the more individuals are told that that's not how they're feeling, or it's not the right way to feel, the more they feel bad about themselves, and the guilt and shame come into play.
And I think when you're working with somebody that has suicidal ideations, thoughts, it is important to get the family involved, or friends, or those things that are worth living. And you get them involved in the therapeutic process to help their success rates improve.
Because often you hear after the thought that people will say, oh, I saw this or I saw that, but I didn't want to say anything. So,
And then they experience the guilt.
right.
Right.
So trying to get involved their friends and family prior would be one of the best avenues.
Absolutely.
So how do you get help?
We hope they would want to be on, but typically it's family or friends noticing something's different. It goes back to the stigma to, you know, talk about it. So often, especially when it comes to suicidal ideation, it's like that pink elephant in the room. No one wants to talk about it. Some of the myths are, if I talk about it, it's going to make them think about it more or want to do it. I can guarantee it's not. They're already thinking about it. And so you talking about it isn't going to make it any worse, but it's going to now let them know, okay, I might have a support. Someone's there in that sense.
So then in those cases, just listening and being a friend
Absolutely.
seems to be very crucial.
It is. I think, my personal opinion, human beings, we're fixers. So if someone comes to us with a problem, we want to fix it. We don't want them to hurt. We don't want them to feel that way. But that's not always the answer. And sometimes someone just needs to listen. I don't know if you've ever been in a situation where you talk to someone about an issue you're having and they tell you what you should do. And you're like, that's just not going to work, or whatnot. And it's like, I said, so sometimes just listening, which is one of the hardest things to do, because again, we want to fix, we want to help. But they don't realize how much listening can help.
So in that case, we're just listening and not giving advice.
Yes.
Yes.
Now that might be the hardest.
That is hard.
I'm a
That is
talker, so I'm
very
going to tell
hard.
you
Even
what
as a
to do.
therapist, it can be hard.
Yes. Yeah. All of our training, we're trained. Don't. They have to come up
advice.
with.
Yeah.
It's not about giving advice. And I think that's one of the hardest parts, especially when you just don't want
Another
to see
thing
someone
with
hurt.
keeping it casual, what's that? How do you utilize that tip? Keeping is it the conversation or what? Keeping it casual.
I think the conversation, not making sure, not making them, not making them feel judged. When individuals feel judged, it goes back to humiliation. And if they feel that, they'll shut down really quick. Probably won't be honest about what they're thinking or feeling or minimize it.
And
Which
I
is-
was thinking, I'm sorry, I
No,
was
go-
thinking on that keeping it casual. Often you might want to use too much medical ease, I like to say. And often when we're talking to the community, sometimes I have to, especially some of our physicians, to say, you need to bring it down another level. So.
Well, I think it's easier for therapists and trained professionals to be more casual, but when it's a family member or a close friend, it's a lot harder because you're more emotionally involved with that person.
Correct.
And people become emotionally reactive when they learn that a loved one is thinking about suicide.
They
or
want that magic wand.
Absolutely.
We want that quick fix.
Correct.
Society, we're developed. I say the microwave, fast food, drive-throughs.
Yeah.
We want that quick fix. But sometimes it's not always a quick
And
fix.
how are you encouraging people? How
Please.
do you get family members to encourage the person to reach out for help?
Oftentimes, rapport is a huge thing in therapy. You have to build a rapport with someone. There has to be a sense of level of trust with the individual. So I think starting off with that, getting to know the person, finding out who are they, what are their likes, how do they like to learn. I'm one, when I ask my individuals, if they're a homework person, worksheets, someone's busy, that's probably not going to happen.
Correct.
Do they like to journal? So I like to try to find out who they are and what their style is and work with that.
It's some of the resources.
Oh, absolutely. So
what are some of the resources
if you wanna-
that are available?
if you want to look at your screen, you can call. They have several suicide prevention hotlines, but the one on the screen is the most prevalent one. And then there's a crisis text line. So some of those individuals that do not want to talk to someone, we have the ability to text that you need help. The veteran crisis line, and then they have a specific one just for teens and the LGBTQ population as well.
And then locally.
Oh, locally. So Reid, we just started a
Now I'm singing to
I
you.
know. Because local resources have always been challenging in several communities, especially more rural areas. There's the community mental health centers, there's Reid, there's EAP. We recently started a depression and anxiety support group. That's 2 times a month, so the second Tuesday and the fourth Tuesday of the month. And then Centerstone has a crisis phone number, and so does Meridian.
Oh, great. The other thing with getting with the resources, some of the you have inpatient options at Reid?
Absolutely, and so this is kind of the stigma too. So some people may need to go inpatient. So those are the people that have the plan for suicide. So we have, Reid has inpatient, and then further out there's resources in Indianapolis and Lafayette. So Options, Bloomington, Community North, and Bella Vista.
So one of the biggest thing that I've seen is the stigma.
Yeah.
And I know there's lots of campaigns to stop stigma in various things. So with the suicide, what can you tell us on some methods on stopping?
I think with the stigma, again, is making sure that the person feels comfortable talking about it. It's not an easy thing, and it's not typically easy for the person that's talking to the individual that is contemplating. So again, the myth of don't talk about it. If we just ignore it, it'll go away. It won't. They're thinking about it is to talk about it. Oftentimes, I let individuals know if you're truly concerned. Going to the hospital is not an easy thing. So if you're truly concerned, or if you have a family member or anybody, call for a wellness check. If you're getting statements or you're getting text messages or someone is saying stuff and you're just not there's always the option to be able to call for a well check, just to say, this is happening, can you please just go check on the person? And that way, they can go see how they're doing and bring them to the hospital to be evaluated.
And what about changing words and perceptions?
Absolutely, that's really important. So I think if we, like Tanja mentioned, we need to ask, are you feeling suicidal today? Don't beat around the bush. But there are some words that are hurtful to people that could increase the stigma. So we like to say people with a mental health condition rather than identifying that person as
the crazy person,
yes,
or
so,
she's got bipolar. You
right.
hear that often.
Yes.
That's just inappropriate, and I think that really makes people fearful of getting help. So I think there's a lot that we're doing to reduce the stigma, but we have a long way to go.
Okay.
Yeah.
Well, I want to thank you, Tanja and
Thank
April,
you.
for joining us today on Reid Beside You. And we will leave you with the local places that you can get help for suicide prevention. And thank you for joining us today on this episode of Reid Beside You.